Hello, my name is Megan Glenn, and I'm the National Senior Director of Programs at the American Liver Foundation. I would like to welcome you to today's program, What You Need to Know, Diabetes and Protecting Your Liver, brought to you by the American Liver Foundation and the American Diabetes Association. We are very excited about today's program. This is the first ever collaboration between the American Liver Foundation and the American Diabetes Association. And it's more important than ever that organizations like ours come together to educate the public about the connection between type 2 diabetes and non-alcoholic fatty liver disease, or NAFLD. Type 2 diabetes affects 34 million Americans, and it's estimated that 40 to 70% of patients with type 2 diabetes have underlying NAFLD. These numbers continue to rise. Today, we will learn more about the association between these two diseases. Before this program, we asked what questions you have about diabetes and liver disease. Today, we will be answering those questions. If you have any additional questions, please feel free to post them in the chat. I would now like to introduce today's speakers, Dr. Tamar Taddei and Dr. Robert Gabbay. Dr. Taddei is Professor of Medicine and Vice Chief of Faculty Development in the section of digestive diseases at Yale School of Medicine. She is also a board-certified transplant hepatologist with expertise in advanced liver disease and liver cancer. Her research is focused on outcomes and clinical trials in cirrhosis and liver cancer to improve the lives of people living with advanced liver disease. Dr. Robert Gabbay is the Chief Scientific and Medical Officer for the American Diabetes Association. Dr. Gabbay leads the ADA's efforts to drive discovery within the world of diabetes research, care, and prevention. Previously, Dr. Gabbay served as the Chief Medical Officer and Senior Vice President at Joslin Diabetes Center and Associate Professor at Harvard Medical School. At Joslin, he oversaw the clinical care for 25,000 patients, as well as the education and care programs Joslin delivers nationally and internationally. His research focused on innovative models of diabetes care to improve diabetes outcomes and improve the lives of people with diabetes. Okay, I will direct this first question to Dr. Taddei. Dr. Taddei, can you please explain what non-alcoholic fatty liver disease is and how it's diagnosed?
So non-alcoholic fatty liver disease is really an umbrella term. And I think when you are presented with a diagnosis like that, you have to unpack it. So first of all, it's fatty liver disease, meaning there's fat deposition in the liver that is not associated with excess alcohol intake. And why is it called non-alcoholic fatty liver disease? It's because fatty liver disease and alcohol-associated liver disease look the same under the microscope, but they are different diseases, okay? And really, when I say it's an umbrella term, it's because it means that there is some fat in the liver, but it doesn't really give you an idea of what we as physicians are really thinking about with fatty liver disease. So if you have fat in your liver, that's one thing, but that fat can actually start an inflammatory process. And that can lead to something called steatohepatitis, right? Hepatitis is a catch-all term, like any itis, arthritis, iritis, itis, right? It means something's on fire, right? So non-alcoholic steatohepatitis means there's inflammation in addition to fat. And when that happens, we worry that those people can go on to develop scarring as a reaction to the inflammation. Just like if you were to cut your skin and you'd have a scab there, oftentimes as the skin begins to heal itself, it leaves a scar. The liver can do the same thing. So it's on a spectrum. NAFLD, or non-alcoholic fatty liver disease, just means there's fat in your liver. But it also means we as physicians have to do a lot more digging with you on the journey with us to know, is there inflammation or not? And is there scarring or not?
Thank you. And a follow-up to that, can you talk about what is NASH and the warning signs of NASH?
Sure. So NAFLD encompasses NASH. NASH is that non-alcoholic steatohepatitis, meaning that there's itis, there's inflammation in the liver. there is often no symptomatology for fatty liver disease or for NASH or even for cirrhosis, which is really the consequence we want to avoid here. And that's why it's so important. It's very, very hard for people to understand that they can have a disease process and not feel anything, okay? And oftentimes when people develop diabetes, for example, they'll come to the attention of their physician because they actually are starting to feel sick. They may be losing weight, they may be having other issues, they may be fainting, they may be having, you know, hypoglycemia, hyperglycemia, symptoms associated with diabetes, for example. But not everybody with fatty liver disease has diabetes, so they may have no warning signs at all. And most people really don't have warning signs until their liver is quite sick. And if that's the case, they would feel fatigued. That's the most common symptom. And then they can actually develop signs of liver failure, which are very, very late symptoms. So I think it's very important to think about fatty liver disease kind of as you would think about high blood pressure. Most people don't have symptoms with high blood pressure. They go to the doctor, they're told they have high blood pressure, and they're put on a pill because they're told that they have a risk of stroke, for example, or heart attack. And anybody would want to prevent those dire consequences, right? So, but they accept that because they know that there are consequences, even though they may not have symptoms. And so what I'd love for people to understand is there are dire consequences to fatty liver disease, even if you don't have symptoms. And that's why it's really important to investigate it further.
Thank you. Dr. Gabbay, this question's for you. What is the connection between fatty liver and diabetes?
Well, you know, sadly, there is a very strong connection. And, you know, this is one of those things that most people with diabetes don't think about. Meanwhile, you know, as much as half of the people with type 2 diabetes, as example, have non-alcoholic fatty liver disease, or NAFLD. We'll try to sort of use that as a simpler way of saying things. And the connection, you know, we're still understanding why it's so common, but we know that probably at the center of all of this is obesity, and particularly obesity in a certain area of the body, visceral obesity, belly fat. That seems to lead to development of diabetes, lead to development of heart disease, and lead to development of liver disease. And so there's a really strong connection between diabetes and liver disease and NAFLD.
Thank you. Another question for you, Dr. Gabbay. The American Diabetes Association recently released their updated 2022 Standards of Care Guidelines, which included recommendations for liver disease. Can you please expand on what these standards of care are, why liver disease has been included, and why that is so important that it was included?
Yeah, you know, so every year the American Diabetes Association publishes this document. It's a 200 some odd page document, and it really defines, based on all of the research that's been done over the last year, and interpretation of all that, what should be the recommendations for clinicians around the world of how to manage people with diabetes, what to do, and how to best take care of them. So, you know, in part because of what you described, Megan, in the introduction, liver disease is becoming so common for people with diabetes. We need to think about diagnosing it, because most people with diabetes that have liver disease have no idea. As Dr. Taddei said, there's no symptoms in most cases. So how would they know? So we need to, it describes how to make the diagnosis and then what to do about it if somebody with diabetes has liver disease. And so really important instruction for healthcare providers around the world to think about this important disease. And, you know, in large part, that's why we're here today, to spread the word to all of the viewers.
Thank you. Another question for you. If you have type 2 diabetes, what steps can one take to prevent NASH?
Well, that's really important, and that's the I think the good news here is so it is really common for people with type 2 diabetes to have liver disease and NASH, and there's lots that could be done. When I started, I said that obesity and visceral obesity is sort of the central problem, we think, in leading to this issue, and so ways in which you can lower your weight and have weight loss are the best treatments for treating NASH and preventing developing of liver disease. And so, that's not so easy. We understand. But there are lots of resources at the American Diabetes Association website, diabetes.org. It involves thinking about what you're eating, and there are great examples of ways to think about that on our website, and also increasing your physical activity, exercising a bit more, and it starts with small steps, making small changes in your life that ultimately lead to the weight loss, and that can improve liver health.
Thank you. This question, Dr. Taddei, is for you, and it's along the same lines, but if you have anything additional to add from what Dr. Gabbay has mentioned, this question from the audience is, when someone's diagnosed with prediabetes and moderate fatty liver disease, what's the appropriate treatment?
Very good question. I think it's really, as Dr. Gabbay mentioned, trying to figure out how to modify risk factors, chiefly being overweight, which often leads to insulin resistance, which is essentially where people are sort of in that pre-diabetes bin, where they do some studies, they say, oh, well, you're insulin resistant, but we can't really call you diabetic yet. That's a warning sign that you're headed in the wrong direction. And if there is associated obesity or overweight, it's time to really get that under control. There aren't pharmaceuticals out there for that particular instance. So there are two drugs that have been looked at in clinical trials for NASH, one being pioglitazone, which is a drug that's used to treat diabetes. So you would have to have diabetes, which if you're pre-diabetic, you wouldn't be put on that drug. The other is vitamin E, but vitamin E actually has some risks associated with heart disease. And so we don't usually use vitamin E. And I would not use either one of those drugs without careful consideration, because we actually have better drugs than those for management of both diabetes, but also obesity. There are new drugs for obesity. And so we're actually at this crossroads where we have wonderful new therapies for both obesity and diabetes that are undoubtedly going to have an effect, and a beneficial effect, on NASH. All of these things are new and we're studying them. So there's great promise. However, what I think is most important is understanding that these are chronic, lifelong conditions. So once your body has shown you that you're insulin resistant, it means that at some weight threshold, you may always be insulin resistant. And it's really a warning sign to get your body under control into a set point that you're not insulin resistant, and you can do that by diet and exercise. And that's really key. We have to practice preventive medicine before we think about pharmaceuticals.
Thank you. Dr. Gabbay, you touched a little bit on healthy diet and resources available. This question does touch on that. What kind of foods diet are best for patients with NASH and diabetes, and what foods should be avoided?
Well, the way we like to think about it is not singling out a food and don't eat this food and eat that other food, but more a meal plan. How do you think about eating in general? The primary goal here, really, when we're talking about liver disease, is weight loss. And so what I'll sometimes do with my patients is say, have you ever been successful in losing weight at some point in your life? Because many people that are overweight or have obesity have tried to lose weight. And, so I say, have you ever tried something that's worked? And ask them what it is. And that may be a good starting place for them, as long as it's not, anything too extreme in terms of diet. So, we know that added sugar really has no nutritional value, so that's an easy place to start. There are all sorts of foods that have added sugar that you don't even realize, so look at your labels. Fast food, if that's something that you eat on a regular basis, most of that is not going to be a good choice for you. Having more vegetables is generally going to be helpful for you. The best is meeting with a dietitian who can tailor a meal plan that works for you, that takes into account what you like, what you don't like, and makes those shifts. And the last thing I'll say is, people that make radical changes in the way they eat all at once, for better or worse, tend not to be successful in the long run, because as Dr. Taddei said, this is really a long-term issue. So whatever you're going to do, it's got to be a new way of eating that you're going to do in the long run. And so make small changes. Think of something you can change in your meal plan that will make you a little bit healthier, and then do that, and then add something else and add something else till you get to where you want to be.
Thank you. Another question for you, Dr. Gabbay. If a teenager is diagnosed with NASH and had high liver enzymes, and then also has PCOS, and is insulin resistant, could all of that be related?
Yeah, it actually can. So PCOS is polycystic ovarian syndrome. And essentially what that is, it often, the way a woman might know she has it is having irregular menstrual periods. And it's one of the common causes for irregular menstrual periods. And if we think about why people develop polycystic ovarian syndrome or PCOS, it's the same central problem. It's insulin resistance. So you think of insulin resistance as the central problem, and depending on what organ is involved, it will cause a different problem. When it's the liver, that's NAFLD and NASH. When it's the ovaries, it's polycystic ovarian syndrome. When it's the pancreas and muscle and other organs, that's developing diabetes. So insulin resistance is really that central piece. And for most people, insulin resistance is related to their fat accumulation around their organs, otherwise known as visceral obesity.
Thank you. I think that's such a good point, just to show that the body does not work in silos. Everything works together. And that's why it's so good that we're doing this program today.
And if I could add one thing, so, and then why do we keep talking about weight loss? Because weight loss gets at that visceral obesity that is the cause for that insulin resistance, and affects all of those different conditions, whether it's liver disease, polycystic ovarian syndrome, diabetes, or heart disease. All of those relate to those central problems of insulin resistance and visceral obesity.
Absolutely. Thank you. Dr. Taddei, you touched on what treatments are available now. Could you touch a little bit on what's in the pipeline for treatments in the future for NAFLD and NASH?
Sure. Before I touch on actual drugs, I think it's important to really think about treatment as a multidisciplinary venture. Okay, so just like all your organs are intertwined, so is your psychology. And so are your habits, right? So essentially, to really tackle fatty liver disease, it needs to be done in a multidisciplinary setting where you have specialists that come together depending upon, sort of what your clinical situation is, that are also supported. So not just physicians, but health psychologists, nutritionists, and people who can really sit down and say, how do we really think about your habits, your lifestyle, and how to preserve your quality of life, but also understand that there are changes that need to be made, and to keep those changes gradual, but to actually keep you informed. So I think knowledge is power, right? And the more diversity of opinion that you have in managing your condition, the better, right? Because then you're really, not only do you know about your condition, but from several different points of view how to really control the condition. And I think that's probably the most important leap in NAFLD, is so many societies are now coming together to think about multidisciplinary management of this complex disorder, okay? So it's the American Diabetes Association, the ALF, the American Heart Association. There's a lot of synergy that can happen to really foster the right treatment environment for patients, so that they feel supported, and so that they really don't feel like their organs are in a silo, at least when it goes to seeing specialists. Do you really need to see an endocrinologist, a hepatologist, a cardiologist? I mean, it becomes tiresome, right? So that is probably the biggest advance I'm seeing in terms of really a coming together around how to do this properly for the patient, right? And sometimes those types of changes are better than any drug, right? So when it comes to drugs, I think we're really looking at drugs that affect insulin resistance and obesity. And there are different classes of those drugs. And when you see your physician, you should ask about them. There are new drugs. There are new drugs for obesity. There are new drugs for diabetes. Can you tell me if I'm eligible for these drugs? Some of them are injectable. So that can be a leap for patients to really want to take an injection. Although one would argue that, if diabetes goes unchecked, then insulin becomes the final common pathway. And that's a much more common and frequent injection than the injection drugs that are now available to treat diabetes and obesity. So I would caution patients to approach things with an open mind. The other class of drugs are antifibrotics. So these are drugs that are aimed at forestalling or preventing the process of scarring in the liver, which happens as a response to the inflammation in non-alcoholic steatohepatitis. Now, those fibrotics, there's a lot of antifibrotics in the pipeline. Fibrosis is something that is felt by every organ in the body, okay? When people say you have hardening of the arteries, that's a fibrotic cascade, right? People who have other types of organ fibrosis. So these, just like your body's not in silo, the mechanisms of how we develop disease in the body are also not in silos. They're what we call sort of canonical or umbrella pathways to illness, and fibrosis is a big one, okay? Just like inflammation is. And what's really important, because we have now drugs in the pipeline for diabetes, obesity, and fibrosis, is properly risk stratifying people with fatty liver disease to determine when to time these drugs, and how to really put people in the right categories. So you may have heard a lot about precision medicine in oncology, right? How do you really know what's going on with that person's cancer? Well, you do genetic testing on a tumor and you give them just all the right combination of medicines, right? And that's wonderful. We want to provide personalized medicine. It's very important. It's important for the patient, but it's also important for the whole population, because you can't look at the population as one big bucket, because there are lots of subpopulations, right? So who is it that just has fat with no inflammation? They probably don't need any drugs. They just need to really look at lifestyle modification. If that's just fat in the liver with no surrounding inflammation, how do we really figure those people out? People who have insulin resistance driving their fat in the liver, we may want to absolutely treat that, right? Especially if they develop diabetes. But then are people actually going more towards fibrosis? Are they sort of further down the spectrum? And in those patients, we may want to think about those antifibrotics. And you could say, well, how do you know, right? How do you know who goes into which category? And we do have tests to try to risk stratify patients, which is why it's so important to see your doctor to really find out where you fit in that spectrum of, fat, inflammation, and fibrosis, and what would be best for you.
And I think you make a really good point around seeing your provider, and that's why I think we're all working to educate providers, particularly primary care providers, that we'll see the bulk of people with liver disease, because again, 90% of people with type 2 diabetes see primary care and never see an endocrinologist. We need to ensure that our colleagues are aware and knowledgeable about how to stratify risk, how to identify what the best sort of treatment recommendations are for any given individual.
Thank you both. Dr. Taddei, we have another question for you. Can NASH be reversed to NAFLD or disappear entirely?
Yes, it can. So now it's important to understand that the gold standard for a long time in studying fatty liver disease was biopsy. So we would basically study the patient by taking a small liver biopsy and looking at it under the microscope, determining the quantity of fat, and then determining over time, with weight loss or any other intervention in the context of a clinical trial with a second biopsy, had that fat gotten better or disappeared, right? So the problem is that biopsy is not without risk, and it's very invasive. And now we have non-invasive liver disease assessments that we can use. They can be very sophisticated, like an MR elastography, which looks at both fat and scarring in the liver, but they can be pretty simple, like a simple calculation, which takes into account liver enzymes, age, and platelet count, for example. So those are just common blood tests that we do every day. The other thing is that fat is pretty visible on CT scan, and a lot of people actually come in for other things unrelated to any liver problem, and they'll get a CAT scan of their abdomen, for example, and it'll show there's a lot of fat, right? And that's actually how a lot of people get diagnosed with fatty liver. Believe it or not, they go in for another thing and somebody says, oh, you got a lot of fat in your liver, and then they're like, hey, what's this all about, right? And we have seen in patients who've lost weight that on a subsequent CAT scan, perhaps for follow-up of that other condition, the fat has completely disappeared. So we know that it is reversible. It must be reversed ideally before it goes on to fibrosis, to that scarring phenomenon that I was talking about. But it is reversible, and it is likely entirely reversible if it's caught at early stages.
Thank you. Dr. Gabbay, can bariatric surgery mitigate diabetes and insulin resistance and ultimately NAFLD NASH?
Yeah, well, that's a good question. So bariatric surgery really has a lot of advantages, and in the context of what we're talking about, people end up losing a lot of weight. And really, a lot of this ends up improving if people are able to lose weight. So in the early stages of disease, certainly for people with diabetes, individuals lose weight, their diabetes improves, they reduce the number of medications that they're on. And if early enough in the course of diabetes, they may go into remission. In other words, not need any treatment for their diabetes and be in remission. So it can be a very helpful treatment. For people with liver disease early in the course of the disease, I think it can be very helpful. I think there is some, and Dr. Taddei would be a better person to speak on this, but there are probably some risks later on, like people with more significant liver disease. It may not be the best treatment, but early on, like so many different things get better, right? Cholesterol gets better, blood pressure gets better, diabetes gets better, fatty liver gets better. Really has a lot of advantages. And of course, it is a major surgery and needs to be done by those with experience and all of that, but it can be a very effective therapy.
Thank you. Dr. Taddei, this next question is for you. How can I cleanse my liver from all forms of toxic substances and food allergies and not strain the liver?
That's a brilliant question, but let me put it to you a little bit differently. So the liver is a filter. Its job is to handle toxins. In fact, it detoxifies your body every day. It is a phenomenal organ, which is why I study it. No offense, Dr. Gabbay, endocrinology is awesome too, but the liver does so many processes silently, like a silent soldier or like the conductor of a fantastic orchestra, right? And so you don't need to detoxify your liver. And in fact, when you think about what the liver does, it's quite fascinating because it really detoxifies all the blood that is essentially coming from your gut. So everything you eat, everything you breathe and swallow, everything you're exposed to on a daily basis, anything that goes through your GI tract, essentially that blood gets delivered from the GI tract to the liver, and the liver, that's done through the portal vein. It's the main pipeline to the liver. The liver is a very privileged immune organ, which is able to identify sort of what is foreign in all of the exposures you have and what is not. So it's very tolerant. It has to be because there's so many antigens and the things we're exposed to every day. And so the liver's job is really to detoxify. So you cannot detoxify that whose job it is to detoxify. Let's put it that way, okay? It's already doing its job, right? So these things that you may see at health food stores or advertised on the internet, you know, liver cleanse, liver detox, they don't work and they could be fundamentally really dangerous to the liver. And because your liver is already, you know, a factory that's working very hard every day, much of what you might take in supplements, especially supplements that you're not entirely sure of the ingredients, and we really never are sure of the ingredients because they're not FDA regulated, could actually cause a lot of stress to your liver. And so I would say there is no way to detoxify your liver, that to endeavor to detoxify it is likely dangerous, and I would stay away from supplements unless they are prescribed to you, and unless you've actually, you know, gone through testing to determine whether you need that supplement. So be careful, because every year there are cases of acute liver failure from people using supplements that are not FDA tested, that we are not sure about what their ingredients are. And liver failure is a terrible, terrible disease, and you want to avoid it.
And so, you know, in hearing that, I think it's a great way to think of this is you've got the great detoxifier right there. And what we all want to make sure is that we don't load it down with lots of fat, because that really is the problem here. You know, that is fatty liver. It's mucking up that great detoxifier with gobs of fat in a way that's not helpful.
I love that. Absolutely.
Thank you both. Okay, Dr. Gabbay, do you recommend patients do their own research after a new diagnosis? And if so, do you have any recommendations for patients doing their own research?
Yeah, you know, knowledge is power, and it's important to learn what you can about any condition that you might have and find out about. And the important thing is to go to reliable sources, because I think we all know the internet has all sorts of things on it and all sorts of wacky stuff. So going to places that are trusted sources. And so, you know, around diabetes, the American Diabetes Association website, diabetes.org, has a wealth of information on everything related to diabetes. And the American Liver Foundation, a great source for understanding liver conditions and what you need to know in that regard.
Thank you. Dr. Taddei, do you have anything to add to that question?
Yeah, I think it's important to really curate the information that you seek when you're trying to learn about conditions. as researchers and physicians and scientists, we actually use an online product out of the National Library of Medicine called Medline. That's sort of how we search for papers if we're interested in learning about a new condition. And they actually have beautifully curated patient-facing materials on a website called Medline Plus. And you can go there and you can look up information that has been curated by the National Library of Medicine. And I think that's probably a great place to start for people who are just, wondering, what's sort of the best thing to read, or where do I even begin, right? There's just so much out there. So that is a very reliable source, in addition to all the wonderful information that's brought to you by the ADA and the ALF.
Thank you very much. And we will include that link in the chat. Okay, that's all the questions we have time for today. Thank you, Dr. Taddei, and thank you, Dr. Gabbay. It has been such an informative program. For additional information about liver health, please visit liverfoundation.org. And for additional information on diabetes, please visit diabetes.org. Thank you for joining us today.